Welcome to another episode of the Your Longevity Blueprint podcast. Today, my guest is Dr. Peter Osborne, who is one of the most sought after alternative and nutritional experts in the world. He's the founder of the Gluten-Free Society, the world's #1 resource for all things gluten. In addition, he's the author of the best-selling book, No Grain, No Pain, published by Touchstone, Simon Schuster. He's been featured in or on Fox News, CBS, PBS, New York Post, U.S. News, Muscle and Fitness, Hers, the Journal of Gluten Sensitivity, and many other nationally recognized publications. And most recently, he's been working on a special project, a mold documentary called Moldject, which I'm sure we'll talk about today. So welcome to the show, Dr. Osborne.
Thanks for having me. It's a pleasure to be here.
So we absolutely have to get to the topic of mold. And I know your family's been personally significantly impacted by that. But before we get to mold, I told you before we started recording, I can't have you on and not talk about gluten and grains. So we have to start there. So let's start with gluten and your opinion on that, right? Is gluten the devil, or what are your thoughts on gluten?
I don't think it's the devil per se. I think more than anything, I think there's a large percentage of people with gluten sensitivity.
Mhm.
1% of the population has celiac disease, which is an autoimmune disease of the small intestine caused by gluten. And estimated 14 to 40% of the population has non-celiac gluten sensitivity, which means they will manifest a gluten reaction other than celiac disease, right? So we have, if we look at gluten as a whole, it's arguably the most well-researched food protein that we know can induce autoimmune disease. And there's multiple research studies on this. There's multiple medical case studies published. Yeah, I've been doing this for 25 years in clinical practice. Most of our colleagues have been doing something similar. If you ask most functional medicine doctors, what's the #1 food that
Hmm.
you should avoid if you're trying to overcome your autoimmune diagnosis, the answer is going to be universally gluten. Um, why is the big question. Why all of a sudden, that's what many people think. Why all of a sudden are so many people reacting to gluten? And I don't think it's an all of a sudden thing. There's pre-biblical text that talks about the celiac affliction. 2000 BC, I think, was the first writings somewhere in that neighborhood. I may
Wow,
be a
I hadn't
little
heard that
off
before. Yeah, yeah.
in the quantity of years. It may be a few hundred years plus or minus, but it's BC was the first
Hmm.
writings on discussion on gluten sensitivity as being, a trigger. And outside of that, we have to think about what gluten actually is. So is it the devil? No, but what it actually is it's a family of proteins. It's not one protein. Many people use the term as a singular term like gluten, but it really should be glutens, right? Um, there were 400 new gluten proteins discovered, I want to say 2018, 2015, somewhere in there. It was a group of researchers in Australia, Anderson et al. And so we don't have this one gluten protein, which is part of the problem, right? Because when somebody goes to the doctor to get a diagnosis, they're usually measuring something called gliadin, right? When they're
Hmm.
doing serum lab tests, they're measuring an antibody to gliadin, which is a type of gluten found in wheat, but it's just one type, right? You've got gluten that's found in corn, for example. It's called zein. Gluten that's found in oats, called avenin. There's even gluten in millet, which is classically labeled as a gluten-free
Green, yeah.
grain, panacetin. You've got gluten in rice, called orzonin. So if we look at the spectrum of what gluten is, let's define it. It's the family of proteins found within the seeds of grass that are soluble in alcohol. Now, that's not my definition. That's TJ Osborne's definition, no relation, but he's referred to often as the father of plant protein chemistry. And so he's the one that originally isolated glutens from grains and defined them. And so it's more complicated than just saying gluten. But here's the conundrum. When we're thinking about gluten-free, we look at all these different types of gluten within the spectrum, and we say, okay, these are all very similar. So if the immune system is hypersensitized to one, it's typically going to be hypersensitized to others. And this is why, if you look at the literature on celiacs, because celiac is like hard line,
Hmm.
everybody knows that. What do you see? 5-year studies, 18-month studies confirm that in some cases, 92% of these patients continue to have persistent inflammation despite removing wheat, barley, and rye from their diets, which are the classic grains, right,
Hmm.
that
Hmm.
contain
That have
gluten.
gluten, yeah.
Um, Well, why only 92%? Why that many are not getting better, right? Why that many have
Mhm.
persistent inflammation? And it's because they're using gluten-free substitute products like corn, rice, oats, and they're labeled gluten-free. So
Yeah,
this is
yeah.
where it gets so confusing. This is where people don't understand. This is where a lot of even doctors, they didn't go and do that rabbit hole deep dive on gluten. And I had to do it early in my practice where I was originally seeing patients um, that were doing well the first few months of going wheat, barley, rye free. And then they would discover that gluten-free aisle and they would start consuming larger quantities of rice and oats, larger quantities of corn based products. And then they would have something um, akin to a whiplash, like their symptoms would start coming back or they'd start developing new types of symptoms, right? And we coined that term gluten-free whiplash because that was a pattern that I kept seeing repetitively over and over again. It's like, why did they do better? And then now they're whiplashing back into health deterioration. And so I started looking deeper at the definition of gluten, where it came from, who defined it. And as I dug deeper and deeper and deeper, I started to find research papers and from doctors in South America who were looking at corn because corn's a staple food in South America. And they were studying corn causing reactions in celiac patients, right? And so they were writing about this. And then you look back at the original observation of William Dickey, who was the pediatrician and who defined or discovered the cause of celiac disease originally back in the 40s. What happened, and that's a very unique story, is that he was in a German hospital seeing pediatric celiac patients. Now, at the time, they didn't know what caused celiac disease, but during the war, grain was rationed and the kids couldn't get grain. So what happened is his whole ward spontaneously went into remission, right? And so he makes this observation, publishes his thesis on the cause of celiac disease
Hmm.
as being grain in this sense, the staple grains of Germany, wheat, barley, and rye, not corn, right? Not
Hmm.
rice. And then in 1943, University of Birmingham, Alabama, some researchers isolated gliadin for the first time, and since then it's been like locked in, honed in. That's the culprit. Now, again, going back, I know I'm talking, saying a lot of things here, but gliadin specifically is a type of gluten found in wheat only, and it's important to understand that distinction because gluten, there's hundreds of gluten proteins, if not thousands, and we can't just focus on gliadin. How many of the audience today listening has had celiac testing or gluten sensitive, what they think is gluten sensitivity testing, tested negative, right? But feel better on a gluten-free
Hmm.
diet.
Lots.
That's a
Yeah.
very, very
Yeah.
common finding. Anyway, that's kind of the long and short of it. I could go deeper if you have specific questions you want to dive into.
So if someone tests positive for celiac, let's go back to not the non-celiac gluten sensitivity, but someone has celiac. Do you believe they need to be off all grains? Because you're in essence saying it sounds like there's gluten even in what we think are the gluten-free grains like the rice and the corn.
I do. I believe they
Yeah.
need to be off of all grains. Let me explain some things that we know about. So, in the spectrum of autoimmune diseases, there are a number of different autoimmune diseases inherently linked to gluten exposure that are not celiac disease. That oftentimes patients with celiac disease will have co-autoimmune diagnoses, right?
Hmm.
So, I have celiac, but I also have Hashimoto's. I have celiac, but I also have rheumatoid arthritis or Addison's disease or Sjogren's disease or
Hmm.
psoriatic arthritis or spondyloarthritis.
Hmm.
We're certain that these patients will have persistence in many of these other spectrums of autoimmune disease beyond celiac disease when they continue to eat grain, when they continue to be on what I call it a traditional gluten-free diet, where it's just wheat, barley, and rye as the focus, right? Avoidance. Um, but if they continue to eat these other types of grains, they will, if they, especially if they have other forms of autoimmune disease, they will continue to have persistent problems. Here's the conundrum there. There's no specialty in autoimmune disease. Like you don't go to an autoimmune specialist. You can go to a rheumatologist who looks at autoimmune disease of the joints and muscles. You can go to an endocrinologist who might look at autoimmune disease of the thyroid. You can go to a dermatologist who might look at autoimmune diseases of the skin. But there's no like training formally in
Hmm.
like the realm of autoimmunity. And that's really a big problem because if you take somebody with celiac, also with RA, also with Hashimoto's, now they're seeing a GI doctor, they're seeing an endocrinologist, and they're also seeing a rheumatologist, and no one's making the connection,
Right.
right? This is part of where I was when I was in the VA hospital working in the rheumatology department. I was just like so frustrated. The the gluten itself, if we get grain out, well, a lot of times what you see is the celiac goes away, but also the RA goes away. And also the Hashimoto's goes away. If you don't get grain out, if you just get wheat, barley, and rye out, generally what happens is you get some improvement in celiac
Hmm.
symptoms, you get some improvement, reduction in inflammation, but you have a persistence of these other autoimmune conditions. But nobody's putting it together. They're thinking my Hashimoto's is completely separate from my need to be gluten free. It doesn't, there's no correlation, there's no connection, and they're not thinking along the right lines. Your Hashimoto's would probably go into remission if you would get all the rest of the grains out of your diet. Your RA would probably go into remission if you get the rest of the grains out of your diet. Now, that's not 100% true 100% of the time,
Right,
right?
right.
I don't want to make a claim that going gluten free or going grain free is like the cure all for every ailment that ever affected humanity in the terms of autoimmune
Right. There
disease.
are many triggers for autoimmune
Yeah,
disease.
yeah,
Yeah, yeah, yeah,
exactly.
yeah, yeah.
But we have to start with fundamental. If you're gluten sensitive and your immune system is hypersensitized to it, you better get grain out. Because if you don't, you're going to have persistent inflammatory reactions, whether they're isolated to your gut or not. They're going to shed all over your body. You're going to have migrating autoimmune developments. As a matter of fact, we know that people with one autoimmune disease in their lifetime, if they don't figure out why, will ultimately end up developing six more. So seven.
Six. Oh my gosh.
Yes.
Yeah.
It migrates. This is why you see patients that have Sjogren's, but also have lupus, but might also have eczema and might also have Hashimoto's,
Mhm.
right? And so they just keep collecting diagnoses that, and no, like I said, because there's no like core specialist
Yeah.
that says autoimmune disease is what it is. Here's my opinion of it. Doesn't matter what autoimmune disease you have, it's all the same disease. Whether it's celiac disease, whether it's Hashimoto's, whether it's psoriatic arthritis, they're all the same. They all come with the same categorical triggers, right? If we look at what causes autoimmune disease, food, gluten, the most well studied,
Hmm.
but you can react to any food, right? Number two is nutritional deficiency. Well studied. Vitamin D deficiency contributes to MS. Vitamin D deficiency
Hmm.
can cause RA. Um, and that's just one example. There's
Right,
40
right,
essential
right.
nutrients, right? So you got food, you got nutrient deficiencies. Number three, you got chemical exposures.
Hmm.
This is where the argument coming in about glyphosate. Most people are like, it's not gluten, it's glyphosate. No, it's both.
Hmm.
But also other pesticides, food additives, food dyes, meat glues that are added to processed meats. All these things we know can trigger and contribute to immune dysfunction. And then the fourth trigger is microbial. So microbes. So this could be bacterial, parasitic, fungal. Mold is in
Yeah,
that
yeah.
category. This could also be
Infections, isn't, yeah, 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 yeah.
yep. This could also be yeast. So you rule those four triggering categories out. That's kind of the way I like to think about it. Is you ask
Hmm.
objectively when somebody comes to my office, we actually sit them down. We do a full history and workup, and then we measure those four categories: food, microbes, chemicals, nutritional deficiencies. Now we come back with a blueprint. Most of the things we find are diet and lifestyle oriented. So a big chunk of the heavy lifting comes with just diet and lifestyle change. And what do we see? We see cases of autoimmune remission after case of autoimmune remission after case of autoimmune remission. And these are, I say remission and not cure because, you get in trouble when you start throwing around words
The C word.
like
Yeah,
cure.
yeah,
You
yeah,
get the
yeah, yeah.
you get the powers that be that don't they're not incentivized for cures. They're incentivized for profit that want to shut you up. And we've had our fair share of that. Um, but what do you call it when somebody's asymptomatic and no longer needs medication for their autoimmune condition?
I guess we say remission and not cure, no, but that's what
Yeah,
it is. Exactly.
they're in remission.
Yeah, yeah, yeah.
Yeah.
That's amazing. What about beyond gluten? Are there other hidden compounds in grains? I don't know how you feel about lectins, phytates, amylose. Like, are there other agents that are driving inflammation that concern you also?
Oh, absolutely. It's why the title of my book is No Grain, No Pain, not No Gluten, No Pain, because you have other plant-based compounds within grains. Lectins, there's a really nasty one called ATI, amylase trypsin inhibitor, which interacts with toll-like receptors on the immune system and drives the severity of inflammation. What we call plant-century proteins. Let's go back to the definition of gluten. It's a family of proteins found within the seeds of grass that are soluble in alcohol. But let's think about that a little bit further. What's the function of not just gluten proteins, but other plant century, what I call plant century proteins, is their job within the actual grain itself is to feed the germ. Right. So they have this outer layer, the ectoderm outer layer of a grain, and then you have this inner layer, the germ. And the germ is like the DNA. That's where the grass is gonna harvest from the food source around it, right? Which is in the ectoderm layer. And so all those different proteins are designed to feed that germ so that that plant can grow, right? So that grain can grow. But their job is also to protect it. In nature, we have all kinds of examples of biochemical protection. Plants secrete special oils to deter
Hmm.
insects from eating their leaves off, right? Um, that's just an example. Humans are animated, so we can fight, punch, kick, we can run away. But seeds are not animated. So they have to have some degree or some way to perpetuate their species, their existence. And part of that is through chemical warfare, right? We have to respect that. So many of these compounds like lectins, amylase trypsin inhibitors, serpenins, and other what are called plant century proteins, their job is not to feed you. Their job is to protect and to preserve the integrity of the seed so that the seed can reproduce and propagate and continue to stay alive, as is any life form's role. And so we have, as a society, pretty much just dismissed the fact that eating is this thing we do, but we've stopped thinking about it historically. Like there's a component to eating. Remember that it's dangerous to eat, and I don't want to put fear in anybody's mind. Like don't I'm trying to give you perspective. It's when you eat things, there's poisons in what you eat, natural poisons, even if it's the greenest, most organic, beautiful food in the world. The job of your gut is to extrapolate the poisons out and pass them through your stool and to hang on to the
The
vitamins and the
nutrients, yeah.
nutrients and the minerals, the amino acids, etc., the proteins. Um, so the gut's a quarantine from your mouth to your anus. It's quarantined. It's not attached to your blood supply at all. It's this tight barrier. When we hear that word leaky gut, this is when
Hmm.
it starts. Is because once that barrier is breached, now when you're eating these foods that contain true natural poisons that all foods contain, they can now leak across into your bloodstream and they can start doing real inflammatory stimulative damage. And we live in a culture and live in a society today where we've lost the art of eating in a way that's healthy and conducive to human health. Like we've said, oh, these dyes don't matter, then that pesticide doesn't matter, and this ultra processing isn't going to create any kind of problems. And oh, if I have a symptom, I'm just going to pop a Tylenol. I'm just going to pop an ibuprofen today, and that doesn't matter. That's not really going to affect me. Or these other, we have the worst polypharmacy in the world. Like people, average person over 45 is on 5 or more medicines, and the vast majority of medicines will strip away the gut lining. So like as you treat your symptoms that are probably coming from your diet with an array of medications, that is compounding damage to your GI tract, which is allowing the perpetuation of a leakiness of a quarantine sanctioned area, right? And so now you're getting immune responses that you wouldn't otherwise get from eating those very same things because your gut's been destroyed by your choices. I mean, at the end of the day, that's what it's about. And people will say, Dr.
Preach,
Osborne, you're
preach.
too brutal. I'm not making bad choices. No, I'm not. I didn't say you were making them on purpose. But we have a whole culture that's been that's been misguided. And, the
Hmm.
medical allopathic model of disease treatment is excuse my language, but it's just terrible. I mean, I'm not talking about acute care medicine. I'm talking about any kind of chronic disease. We have the
Hmm.
crappiest model in the world, and the track record is just It's just awful. We have more disease than we've ever had. We have more sick people than we've ever had, and we spend more on medicines than any other country in the world, and we use medicine more than any other country in the world. It's just not working. Empirically, it's making people sicker and sicker and sicker, but it's been normalized by our culture. So like if I always say people in the alternative world, they call us the alternative world. We shouldn't be alternative. We should be
No.
mainstream.
Yes, yes.
Yeah,
Yeah.
the alternative should be medicine
Mhm.
because it's like, okay, if good things fail, like if behavioral changes, diet changes, fundamentals fail, now you have something possibly stronger that you can use to help,
Mhm.
but it doesn't come without a cost. Like that's the other thing is that you can't rob Peter to pay Paul. There's no medicine that you can take that doesn't come without some other type of inherent cost, a side effect. Many drugs, many medications rob nutrients,
Mhm.
from people. And so those costs, if used chronically, those costs add up. And that's where we're at. Anyway, I started to wax and wane
So
philosophically
that
there, but
that was really good. You kind of just answered my next question because I was going to ask if you could break it down for the listeners, like what the connection between specifically grain consumption and autoimmune diseases, as far as like how is eating that bowl of pasta really triggering the immune attack? But I mean, you essentially just were telling us the grains contain all sorts of, we'll just say poisons that are causing this leakiness, that essentially those proteins are getting into our bloodstream, that our immune system is, you can maybe say this better than I, but um, putting the alarm on, sending the alarm, like attack, attack.
yeah, so
But
so think of it
explain
like
that for the
this.
listeners in an easy to understand, yeah, fashion.
Your gut is like the line going into a nightclub.
The
And
bouncer.
and you've got a bouncer there called a tight junction, right? Which is protein that seals the gut lining from anything that doesn't belong. So you don't want to let like a raving lunatic with an AR-15 into the club to start shooting people up. Like that would be bad. So the bouncer's there to say, "Hey, you're good, come in." Right? And so the job of that mechanism is provided largely by there's several barriers in the gut. I mean, there's a lot of redundancy in the protection of the gut because if one barrier fails, the others are still there. But one of the barriers is stomach acid. The acid in the stomach is not just designed to digest protein, it's also designed to kill bacteria, viruses, and other
Mm-hmm.
microorganisms that come through in your food. And if you take Protonix or Nexium or any of these other antacids, Tums, Rolaids,
Yep.
what you're basically doing is you're knocking that particular barrier out.
Mm-hmm.
The next barrier in your gut, the next bouncer, if you will, is the mucosal layer. And so there's a mucin that's produced by the cells in your GI tract that serves as like a mucus shield, right, that prevents penetrance of things that don't belong through those barriers. Then you have these anchoring proteins inside the gut cells themselves that connect the gut cells. It's kind of akin to like a Lego block, the male and the female part, and you snap them together, right? And you create a tight bind. Well, that zonulin, which is that protein that helps to do that, is one of those barriers. And then you have antibodies. In the gut specifically, you have an antibody, a non-specific antibody called IgA, secretory immunoglobulin A, which is think of it like a handcuff. It floats around and it's secreted in your gut and it binds onto things that don't belong. And so now those things can't get through and you just poop
Mm-hmm.
them out. Right.
Mm-hmm.
So you've got these barriers, and then right behind the wall, if those barriers are breached, right behind the gut lining, you have the largest conglomeration of immune tissue called the GALT, the gastro-associated lymphoid tissue. It's the largest area of the immune system. 70% of your immune system is concentrated behind your gut wall. That's on purpose because eating is dangerous. This goes back to what I was saying. Like your body has set it up so it knows, okay, this could be a problem. So we're going to have all these protective mechanisms in place. Now imagine, I mentioned taking antacids knocks out your acid production. Taking antihistamines knocks out your acid production. So if you've got allergies and you're popping Benadryls and
Mm-hmm.
Singulair and that kind of thing, taking pain medicines wipes out your mucosal barrier. So whether it's aspirin or ibuprofen, even steroids will cause erosion.
Mm-hmm.
Baby aspirin at 1/10 of the dose of what's generally prescribed for cardiac patients, so like 7.5 milligrams of aspirin will cause mucosal erosions in your
Mm-hmm.
GI tract. A baby aspirin's 85 milligrams. So we're talking about 1/10 of that, actually even less.
Wow.
Um, And this is the thing, like the people are just like, oh, well, it's just an aspirin. No, it's just not. No, it's literally something that will erode the layer, the
Hmm.
barrier in your gut, and you need to take it seriously because that's the cost. You want to leave your pain behind right now in this moment. The cost is that you're also going to erode the mucosal lining in your gut, and you're going to set yourself up for a problem, right? It doesn't mean you can never use these medicines. It just simply means
Sure.
you better honor the side effect and understand
Yeah.
it.
Yep.
And the
Yep.
failure of medicine has been the lack of informed consent because, my early on expertise, I spent many years studying drug-induced nutritional deficiency, drug-induced side effects, um, because I kept getting polypharmacy cases. And I was like, why are these people not getting better? And we had to strip back the layers of medications. And anyway, the other things that can disrupt that barrier, IgA deficiency is very common, and it's very commonly caused by gluten.
Mm.
It's a common side effect of gluten. So you could take somebody's gluten sensitive eating gluten, and now their IgA levels are dropping. This is one of the reasons why tests for celiac disease are so often wrong because
False
they're
negative
IgA
because they don't.
tests.
Yeah. Yeah.
Yeah, they're using IgA antibodies to measure, anti-tissue transglutaminase,
Mhm.
anti-endomysial antibodies, and anti-gliadin antibodies are IgA antibodies that they're measuring. And if you have IgA deficiency, then you can get a false negative on an IgA test. And so gluten in and of itself can kind of mask the doctor's ability to find it if you think about it that way. And then beyond that, once you have barrier breakage, whatever you're eating can start leaking. And once it starts leaking, it starts stimulating the immune system. So the immune system is there to say, hey, um, there's something here that doesn't belong. We need to neutralize it. And there's many ways the immune system can use to neutralize something that doesn't belong. You can make interferons, and you can make leukotrienes, and you can make like TNF alpha you can make antibodies. There's think of it as there's arms of the immune system that are designed to neutralize threats that are coming into the body that create collateral damage when they're in action. So like if I'm making an antibody as an example to gluten coming in, one of the mechanisms of the celiac damage is that antibody binds to gluten and it creates an antigen antibody complex that causes collateral inflammation to the tissues in the gut. And so in the act of protecting the body, we're also creating damage because it's kind of a war, right? You're creating an inflammatory damage. And so the way out is to stop eating the thing that's creating the complex, that's creating the immune response so that the damage can then heal and go away. But if you continue to eat the thing or do the thing that's creating the damage, then your body's going to continue to try to protect you
Sure.
from the thing that you're doing. But in the process, it's creating a side inflammation or a collateral inflammation that's going to lead to tissue degradation and symptoms. And this is why the change has to happen. This is why you can't drug that away. Like you can't drug away the fact that somebody's being damaged as a result of a gluten immune reaction
Hmm.
or any other food or any other microbe for that matter. You can't drug it away. I'd argue that the only thing you could really probably drug away in terms of causation for autoimmunity is you could potentially drug away a bacterial infection, right? That was maybe driving some of the
Hmm.
autoimmune process. But I mean, name another drug that actually treats to curation versus symptomatic management. There aren't very many because it's not the goal. The
Right.
goal has always been symptomatic management. But anyway, so the barrier itself, once it's breached, then you create a hypersensitized immune system. Think of it like a soldier that's been away at war in a war zone for many years, and he's been being shot at, and grenades have been thrown at him, and here he is. He's just like, I'm not asking questions. If you're coming at me, I'm shooting you first, and I'm asking questions second because my nerves are shot. And this is
Hmm.
what a hypersensitized immune system looks like. It's like a post-traumatic stress disorder from a soldier that's come back from war. And you have to calm it down, right? When do we ever make rational decisions when we're all hyped up and emotional? We don't, right? So we have to step away. We have to calm it down. Then we have a clear head. Now we can think again. And this is what happens to the immune system. It's not that the immune system is behaving badly. Autoimmune disease are really it's a crappy term in the sense that your immune system's not attacking you. Your immune system is appropriately creating chemicals
Hmm.
based on the behaviors and the exposures that you're giving it, and it's doing its best to help you. But if you don't pause and try to help yourself determine what it is that you're doing that's wrong, your immune system's going to keep trying to help you, but the consequence to that is going to be collateral damage. But if your
Mhm.
immune system weren't helping you, you would have died. But now you're just sick with inflammation because the side effect of your immune system trying to help you is chronic inflammation. And that's the intelligence of the body. Your body is giving you symptoms so that you can
Mhm.
pay attention long enough to say, hey, maybe I need to do it differently, right? That's
Yes,
what symptoms
body doesn't
are.
make mistakes. It's sending you the check engine light. Yes.
Yeah.
Yes. What do you say to people who don't have autoimmune diseases, who've been eating grains their whole life, who think grains are healthy, right? Is there still silent damage happening without obvious symptoms? And what is that silent, if so, which obviously you're going to say yes, if so, what is that silent damage going to look like in the long term?
You just gave me a loaded question, right? You knew I was going to say yes. Um, so there's actually a term that we use called silent celiac disease. Okay, you can Google search that. It's in the medical literature. We've been talking about it for years. There's another term called non-celiac gluten sensitivity, which was not my term. It was actually Dr. Marsh. Marsh was the GI who developed the biopsy diagnostic classification criteria for diagnosing celiac disease. And he was known for saying, look, there's a large percentage of people that have normal biopsies that are still reacting to gluten. And they can even be asymptomatic, hence the term silent celiac disease. Because but by the time it's like diabetes, by the time you've eaten enough sugar, initially your body is resilient. It's adaptive. It's healing. It's repairing. Your body doesn't just die when you make one mistake. It's very resilient, very potent at healing. So when you do enough damage, however, and you get into what's called a repair deficit, where the damage you're doing has surpassed your body's speed or expediency by which it can heal, that's when symptoms show up. And how long does it take for diabetes to get diagnosed in the mainstream medical world? It takes about 30, 40 years. Why? Because the tests that they're using to make the diagnosis are end stage disease tests. By the time your blood sugar is absolutely out of control, it's because your pancreas has started to fail, and your pancreas has got decades of reserve in it to make insulin despite your crappy diet, right? So think of that like gluten. By the time you've overconsumed gluten to such a tremendous degree, you finally reach a point where your body's like, hey, we can take no more of the damage. Um, because we don't have the capacity or the reserve to heal because now it's starting to affect and impact our ability to absorb nutrients from the gut, right? So
Mhm.
we get malnutrition in the presence of inflammation. It's the perfect storm because your body uses vitamins, minerals, amino acids, fats to heal, to repair, right? To make energy. And when that starts to suffer, you no longer have a reserve tank. You now start to develop symptoms. There's also a mechanism with gluten specifically where when your body is breaking down and digesting gluten, it can create a family of proteins called gluteomorphin or exorphin, sometimes also referred to as exorphin. These proteins interact with morphine receptors. So you think about that for a minute. What does morphine do? Blocks pain, makes you feel
Mhm.
good.
Mhm.
So gluten can mask its own toxicity in these types of individuals as well. So like this is why some people go through gluten withdrawal
I
when
was just going to
they
ask, so do you advise patients slowly reduce the gluten or did they abruptly just take the grains out?
case by case.
Yeah.
Ideally in a perfect world, get it all out today because it's the one
The
thing you
sooner
can
the better.
control.
Yeah.
If you're trying to offset the potential for gluten withdrawal, maybe you're one that has headaches, irritability, mood swings, low grade fever, kind of like jonesing when you're coming off of drugs. Like if you go to a rehab place, you see kind of the symptoms these folks have. There are ways around that. You could take high doses of vitamin C, vitamin B3, theanine. These are all great ways to basically offset some of the symptoms of withdrawal, which can also happen because I get people from time to time that say, "Man, I feel worse when I eat grain free." Yeah,
Hmm.
you're jonesing for grain.
Hmm.
It's the morphine,
Yeah.
the
Yeah, totally.
gluteomorphin.
Do you have some, before we get to mold here, one more question on grains. Do you have some dramatic health turnarounds you've seen in patients from removing grains that you could share? I mean, obviously, you've already mentioned some autoimmune diseases essentially reversed. I'll say that. But any other main testimonies, patient cases you want to share?
Yeah, I've had two of my favorite stories. One, a little girl. She was 9 years old when her mom brought her in to see me. She had, at the age of 2, been diagnosed with juvenile rheumatoid arthritis. She had a permanent port embedded in her arm because she
Jeez.
was in and out of the hospital so frequently for pain management. So they put a port in her. She'd been on methotrexate from the age of 2. Now, those of you maybe don't know what methotrexate is. It's a cancer medication. It's very dangerous. It inhibits DNA, and it's used a lot in RA to block pain or to reduce pain. But in a child, it's a horrific choice, because you inhibit growth, you inhibit their ability to actually develop. But she was on this medicine for 7 years. She had the pain management port. And after 7 years of treating her, her rheumatologist looked at her mom and said, "There's nothing more we can do. She may have 6 months. You need to go home and get your affairs in order." And they declined to keep treating her. Imagine being a parent, right? And being told that.
Ugh.
When her mom brought her in to me the first time, she was in tears. She didn't know what else to do. I was like a last ditch effort doctor. Here I
Mhm.
am, a new young green doctor, fresh out of the VA, because that's where I had done a rotation in my graduate training in the VA hospital in the rheumatology department, and I was so frustrated when I left the VA because they would never ever acknowledge diet. They would never acknowledge
Mhm.
nutrients, and I would bring in stacks of literature to the attending physicians there and say, "Can we just try something different?"
Yes, yes.
And they were just like, "No, sit at the back of the room." Um, so when I left, she was one of my first private patients in my private practice. So I think God was guiding her in my direction. I firmly believe in divine intervention in that
Mm-hmm.
way. Anyway, we tested her. She was gluten sensitive. And when we tested her, genetic testing, and I can talk more about that if you want, but genetic testing is really ideally the way you want to test for gluten, because the antibody test can be so misleading. But she was gluten positive. She was also reacting to blueberries. And so every morning her mom would give her a blueberry smoothie because she read somewhere that blueberries were a superfood, right? She was trying to help her daughter.
Mm-hmm.
So when we cut those two foods out of her diet, she had some deficiencies as well. She had several nutritional
I'm
deficiencies.
sure she's on methotrexate. Well, she was for years.
Yeah, yeah. Um, so within 6 months, the port comes out. She's still alive. Within 12 months, she's in total remission, no symptoms, no medicines. Um, Today she's living. She's out in the world. She's graduated from college. I mean, she's fully functioning and still in remission. Uh, Her name was Ginger. She's one of my favorite stories simply because
Yes.
she was one of my first. She's the reason I wrote No Grain, No Pain,
Oh,
and she's the reason I founded Gluten-Free Society.
yeah, yeah.
Because 1 in 7 have autoimmune disease. The vast majority of them are not celiac, and they will never ever have access to information about gluten and grains as a driving force behind their disease. And it's a very real possibility that they will die. And if we look at the number one cause of death in females under the age of 65, it's autoimmune disease. Number one cause. So Ginger's one of my favorite stories. Another one is her name is Shanna. And I actually have her story is actually published on my YouTube channel if you type in Shanna. But she had just a life riddled with torment, eczema, skin issues. She hurt all the time. Her joints ached all the time. But she ended up being diagnosed with many things. But one of her final diagnoses before she came to me was polymyalgia rheumatica, and she couldn't even walk up her stairs. Like she just was on, and all they had for her was steroids, which would control her symptoms. But the longer you take steroids, it causes muscle atrophy, high blood sugar, elevates your blood pressure.
And robs
Uh,
you of hormones. Yeah,
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 and it
yeah,
destroys your tissue. It's a
yeah.
catabolic steroid. Um, so when we got her, she was gluten sensitive as well, but she also had many other things going on. There were a lot of food reactions because of the leakiness. The gut leakiness had just led to her reacting to many of the foods that she consumes, and she also had some mold in her background as well. And by the way, grains we didn't talk about, but grains contain mold. 30% of the grain crop contains mycotoxin contamination, and that's one of the reasons as well why grain versus just gluten free.
That's my next question for you, but finish the testimony.
Um, but she within a 12-month span of time had no more symptoms, just with diet change and nutrition change. And there was some trickiness with her because she had been on steroids for so long. She had a steroid withdrawal scenario where if you don't know what that is, you get what's called scalding skin syndrome, where when you're withdrawing from steroids, your skin starts basically swelling, especially facially, and you get layers of peeling and layers of peeling, and it's a very scary thing to go through. If you look up scalding skin syndrome or steroid withdrawal, you'll see some pictures and you'll know exactly. But I have her pictures are in that video, and you can see what her face was just out here, and that at the end, her face. She's such a beautiful woman, and she, just totally normal, but you can see the comparative. But what it took from her was courage because,
Mhm.
I knew what she was going through. And from the doctor's perspective, it's easy for me to say, hey, trust me, trust me, trust me. We'll get you through this. It's a lot harder when it's happening to you, when you're
Mhm.
going through steroid withdrawal symptom to just trust because your face is just on fire. Anyway, she trusted me. And we got to the end and we got rid of the grains, we got rid of the glutens, we got her malnourishment taken care of, and we peeled back her medicines. Now she's not on any medicine. And she's perfectly fine and doing better than she ever has. And she's been a patient of mine now for over 15 years. So I'm going back in time, like
Yeah,
again,
yeah.
further back ago. But I also treated her children who also had very similar problems. So we saved her children from decades of what she went through. Um, and all it was gluten. I mean,
Mhm.
and not all. The biggest thing was getting grains out of the diet. And
Sure.
I say that because some people will argue, well, functional medicine doctors are so expensive, and we're not expensive. We're the cheapest deal in town. You just don't realize that your medical bill over the course of your lifetime is going to be millions of dollars if you don't figure this out. And if you go see somebody in functional medicine, you might spend thousands of dollars initially to figure it out, right? But now
Hmm.
it's figured out, you can move on.
Right.
But I say that because there are people that, aren't going to be able to afford functional medicine, and that's unfortunate. I think insurance should cover it, but I don't control what they control.
Right.
But if you're watching this and that's you, go grain free. It's free. Doesn't cost you a dime to experiment with your diet. It costs you nothing to do that, and it might save your life.
Hmm. And that's why we do what we do. You go from being the guy who's told to sit in the back of the room and not talk about nutrition to literally changing the trajectory of these not two, but I'm sure it's thousands of families' lives. Like, oh my gosh. Yeah, I can only imagine how frustrated you were in the past, but look at you now. I mean, that's why we do what we do. It's so rewarding. Thank you for sharing those stories because those are incredible. I do want to go to mold next, and I know there's an overlap, but you were alluding to between grains and mold because grains can be moldy because they come from the ground, have to dry out, whatnot. So is someone who's mold sick even more vulnerable to the effects of grains? Or I guess expand on that connection that you were starting
Yeah,
to talk about.
when you were a kid, you probably remember that song, "Anything You Can Do, I Can Do Better."
Mm-hmm.
That's the song that mold sings to gluten.
Ooh.
Yeah, yeah, and they
Ooh.
have a lot of overlap, tremendous overlap. So my mold. So let me just parse mold out for a little bit because there's a lot of confusion in the area of mold. If you go to traditional allergist or traditional ENT or traditional doctor, they're going to tell you mold poisoning is nonsense. They're going to tell you that you can be allergic to mold, and so you might get some classic allergy symptoms like watery, teary, itchy eyes, even some skin stuff if it gets on your skin. But outside of that, mold is not really a threat. That's all designed and engineered nonsense to distract you from what's actually going on. So that's called a mold allergy. Mold allergy is one aspect of how mold can create symptoms in humans, and that's usually what's called an IgE response. It's one of the arms of the immune system where you can produce certain antibodies that trigger the release of histamine. Histamine, as hopefully your audience understands that
Yeah, yeah.
histamine is just a chemical that can increase blood flow. It causes itchiness. It causes redness.
Mhm.
Again, watery, teary, itchy eyes. If it's bad enough, throat closes down. If it's really bad, eyes and face can swell to the point where you need to go to the hospital and get an EpiPen. That's called anaphylactic allergic reaction. But most people won't ever have an anaphylactic reaction. They might have a lower level reaction, but it's the same mechanism. That's mold allergy. So let's set that aside for a minute
Mm-hmm.
and
Mm-hmm.
recognize that that is a real thing. But it is, when we talk about mold-related illness, that's the least of your worries. There's something else called mycosis. And there's mycosis, which is a mold infection, and we'll talk about that. But I want to talk about mycotoxicosis as well, which is where you're being exposed to the poisons that mold produces. So think of mold as a living microorganism. If we're talking about environmental mold, we're talking about a multicellular microorganism that is decaying your home, right? So it's eating the materials in your home, and then it's releasing its chemicals as a byproduct of digesting your home. It's kind of like when humans eat, we poop, right? When humans eat, we expel gases, right? And these
Hmm.
things, imagine these things were poisonous to other life forms in our environment, we would be hurting them. Well, mold, when it's eating, it's releasing mycotoxins. And these mycotoxins are about the size of a viral particle, right? So they're zero point 0.3 microns, so very small, you can't see them. They can absorb through your skin. So if they're aerosolized in your home, you don't have to eat them. They can go through your skin. You can breathe them in. Obviously, you're breathing your air, right? So your air quality, if it's full of mycotoxins, you're breathing them in. We know EPA documents state that when you absorb a mycotoxin, it doesn't matter where it comes from, whether it's from your food, whether it's absorbed through your skin, whether it's absorbed through your respiratory tract, it goes systemic. So once it enters your body, systemic.
Hmm.
So imagine your air that you're breathing is rich in these chemical gases that molds produce. You can't see them, and you really can't smell them sometimes. Mycotoxins don't smell. What you're smelling in a musty environment is not typically even the mold, it's the bacteria that coincides and grows with it. Um, but if you smell must, you know that you probably have a mold issue, right?
Yeah, yeah,
It's
yeah.
so, but the mycotoxins are neurological poisons. So, like
Mhm.
the black mold, which most people fear the most, have heard about the most. Black mold trichothecene is the name of the group of toxins found in black mold. That was actually weaponized. They were using that to make weapons in military, bombs. That's how dangerous it is. So we know it's bad news. But there are other
Mhm.
mold toxins. There's another type of mold toxin made by a mold called Fusarium, called zearalenone, which mimics estrogen. And this is one of the reasons why people in mold start becoming allergic to everything because it's estrogen. And this is why women are more susceptible too, because men make less estrogen than women, right? But
Sure.
estrogen, on a molecular level, too much estrogen will switch your immune system's response to a favored mast cell response. So you'll get more mast cell production, you'll get more histamine reactions in the immune system itself, and that's what for a lot of people causes the histaminic response and leads to diseases like dysautonomia, POTS,
Hmm.
Ehlers-Danlos, because those things, Ehlers-Danlos, when your tissue becomes too fluid and too loose, right? It's actually your fascial tissue that's being bombarded by histamine, and so it's losing its structural ability to hold on, and so you get this looseness that occurs. I'm going way too
No,
deep
that's
into
okay. This is
side,
all excellent. Carry on,
but
carry on.
but you have mycotoxins, they're nerve poisons. It's been proven that they can be neurotoxic in the sense they can atrophy your brain. One of the hallmark symptoms is brain fog. So like
Mhm.
one of the first symptoms that we'll see in somebody that's in a lot of mold is
Mhm.
they'll lose word recall. And it'll seem kind of innocent at first because you don't, oh, what was I trying to say? I don't remember that word. Help me out, right? Like that kind of thing seems relatively innocent. But this is what happened to my wife. I'll share this story with you. So at first, that's what it was. It was brain recall. And so what I found though over the course of our experience in mold, because we were in mold for 2 years before we actually got out, and I know a lot about mold. So any of you that have been in it a long time, don't beat yourself up because I'm a doctor, been doing this 25
Mhm.
years, and it took me 2 years to really figure it out. At first, it was I was filling in her words, but as it progressed, I was filling in her sentences. And then as it progressed, I was reminding her of conversations that we had had earlier in the day that she had completely forgot. And then as it
Yeah.
progressed, she couldn't get off the couch anymore.
Uh,
I mean, my wife's a CrossFitter. She's in phenomenal shape. And she's a warrior. Like she loves to be physical and she loves to do things and go, go, go. She's not a couch potato type of person and never has been. But I would come home and she would still be on the couch from when I had left. And then she got to the point where she was hallucinating things. She would see things. And then she got to the point where she's completely apathetic about life. She didn't want to commit suicide, but she also didn't want to be here. Not if this is what life was like. That was her at her worst. And she confessed that to me after we got out.
I'm so sorry.
I
Yeah,
didn't know
yeah, yeah,
until after we got out.
yeah.
And my son said the same thing to me, my youngest son, who said he just didn't care if he lived or died. Um,
That's just how severe mold can affect you. Yeah, I wonder, I always wonder just lately about mental illness, like how much of that is just environmental toxicity, which is a whole nother tangent. But I mean, you're a perfect example of that. And how would that normally be treated by a psychiatrist
yeah,
with medication, right? I mean,
yeah, go suppress your immune system further. Mycotoxins are similar to radiative damage, to radiative poisoning. Similar way. It's low dose radiation just basically chews away your body and ages it at an accelerated pace. And so if you're feeling older, if your hair's turning grayer, if your skin's getting more crepey,
hmm
if you are having severe mental brain fog at first, but
hmm
it's progressing, if you start to develop odd neurological sensations, neuropathies, numbness, tingling of the hands and feet, electrical pains, if you're
hmm
feeling electrostatic shocks more frequently when you walk across your floor, um, these are all mold. I mean, there
Yeah.
are several mechanisms there that probably we don't have time to get into.
Yeah,
I mean, we
yeah.
could talk about it for 20 hours, but um, these are some of the main things. And if you're experiencing those, you should at least try to rule out or suspect potentially that mold may be playing a role in the decline of your health. And even if you think you're a good housekeeper, I had a patient one. This was 20 years ago. I remember it so well because it was we did a Fox News story where I had two patients that were in mold, and I was just trying to create awareness. So I had one of the Fox reporters I had, and I called her up and I said, "Look, we need to get more awareness of this. Is this something that you guys would be interested in?" And she said, "Absolutely." So she came out and interviewed a couple of my patients. Well, one of them, her name's Rhonda. She said at first when I told her she had a mold problem, she was like, "There's no way." She got offended. She was like, "I keep
Yeah,
a
yeah.
very clean house.
hmm
There's just no way that I have mold." I said, "Look, this is not an insult on how you do your housekeeping. This is just the symptoms that you have." You know, she was having histamine like flushes and elevations in blood pressure. What ultimately happened was they peeled back the cabinets, and the laminate underneath the cabinets was just black mold was growing underneath the laminate. And so they never knew, right? But
Yeah,
her
yeah, yeah.
husband was, as he was replacing the kitchen cabinets, this is when they found it. And I'm like, she was like, "You were right. You were right."
hmm
And this was back at a time where we didn't have the objective testing that we do now.
Sure,
Like now
sure.
we can pinpoint it really easy. But another patient was she was a school teacher, and well, she had rheumatoid arthritis. And what we were doing was we were treating her, and so we changed her diet and everything, and she kind of went into remission. And then the school year started back up, and then she flared again. And then the school year ended, and her flares stopped. That was how we actually
hmm
ended up finding and isolating mold. She had a carpet of mold growing above her ceiling tiles in her classroom. And when we approached the school about it, they declined to do anything about it.
Mm.
So that's why I was calling Fox. Like that's
Yeah,
the
yeah,
reason.
yeah, yeah.
Yep. So I'm like, look, it's not just the teacher. You've got school. You've got kids that are going
Yes.
into this class where,
Everyone's
the school's
exposed.
not doing their
Yes.
diligence. So anyway, the school ended up being torn down after not very long after the news story broke. So we got the school torn down, and we figured out that this woman's RA was a combination of gluten and mold toxicity because it improved with a gluten-free diet, but it didn't resolve until we
Sure.
got her out of the mold. She ended up quitting her career as a school teacher and going back into accounting, which was another degree that she had had because the school
Yeah,
refused, and it took a
yeah,
year
yeah.
or so to get them to actually tear the place down. But that's mold poisoning from mycotoxins. So I know I went a
hmm
long way around, but I'm bringing it back to where we started, which is so mold produces chemical toxins in the air that you can breathe in, you can absorb through your skin, that can land on your food that you can eat, that can make you extremely sick. They're nerve poisons, they're nerve toxins. They can mimic estrogen, they can damage your kidneys. They're carcinogenic. Some of them are. They can cause cancers. Um, but ultimately, from a molecular perspective, they inhibit RNA, DNA, and protein synthesis. in your body. So this is why you get accelerated aging, because you can no longer repair. Your body loses its capacity at repair. And in that process, they're also immunosuppressants. And so now you start picking up infections. You start picking up microbes from the environment that were always there, but your immune system is so distraught and so preoccupied by trying to neutralize toxins that it doesn't have the bandwidth to also handle microbial issues. And on top of that, you have to remember mycotoxins are aerosolized antibiotics. Where does penicillin come from? It comes from penicillium mold. And this is what we take when we have an infection. And so imagine you've got all these mycotoxins that behave like antibiotics that you're breathing in and getting into your GI tract, and they're neutralizing your gut flora. And so now your gut flora diversity just tanks. And this is why people in mold can't eat fiber, can't eat fruits and vegetables. They lose their ability. Many of them go carnivore because it's the only food they can eat, because their microbial diversity is just plummeted because they're being aerosolized every day by antibiotics they can't see. That's mycotoxins. Mycotoxicosis is what that's called. And those are just some of the effects of how that
Hmm.
can impact a person. But once your immune system has been destroyed enough or been beat up enough, you can now get what's called mycosis, MYCOSES, which is the mold that's living in and eating on your home can now colonize you. And because generally a healthy immune system won't allow mold, multicellular mold species have a hell of a time colonizing a healthy human host. And I'm not talking about candida. Candida's yeast, and that's a different thing. I'm talking about mold, aspergillus.
Hmm.
There's a disease called aspergillosis. That's a form of mold infection or
Hmm.
mycosis. And it can create, very commonly, it creates a tumorous mass that shows up in the lung and looks like cancer. And oftentimes people are misdiagnosed and they get treated for cancer and they don't have cancer. They have aspergillosis. This is why any of you with lung cancer should always, always, always ask for a biopsy to rule out, when you're doing all this, to rule out the fact that this is a cancer versus the fact that this is an aspergillus fungal ball that's living inside of your lung fields. We know that mycosis. There's studies coming out now that show that for many cancers, the microbiome, cancers have a microbiome. The cancer masses have a microbiome. People don't realize that. But what we're finding in these microbiomes of cancer is mold. We're finding the DNA
Mm.
fragment of penicillin in aspergillus molds. I just had a patient a couple weeks ago. We had our oncologist do a DNA analysis of the tumor biopsy and found penicillium rather,
Hmm.
as a main part of that tumor. And she was in mold. And the mold she was in was
That
penicillin
species,
or
yeah.
penicillium. And she also was riddled with aspergillus or with penicillin. I keep saying penicillium mycotoxins. So gliotoxin
Hmm.
was one of them that she had. Ochratoxin was one of them that she had. These are the toxins produced by that particular species of mold. So imagine you have a tumor mass that also has mold growing in it that's producing mycotoxins that are further suppressing your immune system. They're allowing your cancer to progress. And the mainstream treatment of that is to hammer your immune system with chemo or radiation, which also further suppresses your immune system. It might, radiation will kill mold. It will, but if it doesn't kill it all the way, guess what happens? It grows back, and it grows back with a vengeance, and now it's
Hmm.
resistant. How many cancers are not cancers? How many cancers are misdiagnosed mold? I think it's an untapped area that needs to be explored. I can't make a claim as to how
Yeah.
common or uncommon it is. I don't know. But I just know what I've seen clinically in people with cancers where we find mold in their environments. We get them out of the mold and we see their tumors shrinking. We see, and if you look at the work of Dr. Makis, and I don't know if you're familiar with him, but he's been using hydroxychloroquine. And actually, more specifically, he's been using ivermectin and fenbendazole and mebendazole, which are antiparasitic medications for cancer patients, and they're watching their tumors just go away. Well, there are now 11 studies on ivermectin as being an antifungal and having antifungal mechanisms. So again,
Yeah, yeah, yeah,
these are
yeah.
all things that we
Sure.
don't know for sure, but they need to be explored. They need to be unpacked, and people with these diagnoses should be exploring these realms, because certainly mainstream medicine does not have an answer anywhere near close to cancer. Most people with cancer die from the treatment of the cancer more than they die from the cancer. But Anyway, back to the mold infection. So we've got mold allergy, you've got mycotoxicosis, which is the poisons that mold produce that can poison your body. And then you have, once your immune system is weak enough, those molds can start colonizing you. One of the more common places they can colonize your lung field, they can colonize your sinuses, they can colonize your GI tract, they can colonize your skin. And when that happens, you've got trouble. There's a 60% mortality rate with aspergillosis, meaning there's a 60% odds that you're going to die and that medicines won't work. Mold infection is on the WHO's top, I think, three for human threats because unlike bacteria, where we've developed and focused all of our attention on bad bacteria, bad bacteria, bad bacteria, nobody's thinking about mycosis.
Mm.
And so there's no pipeline for development for great treatments. You have the same drugs that have kind of been around for decades, right? You've got the azole antifungals, you've got drugs like nystatin and amphotericin B, but beyond that, what do we have as options? Mostly natural things, caprylic acid, thyme, oregano,
Mhm.
you know. But when you have a severity of an infection, mold is smart. It's been around this planet for a very long time. Its job is to recycle everything back to the earth. If you think about what is its job is to recycle you. Now, preferably not while you're alive, but that's what mold does. And it will grow on anything, it will chew through anything. And even metal. A lot of people say, I want to build a concrete metal house. You're not going to protect yourself from mold. Go outside and look at the sidewalk. There's mold growing all over it in the sun. You take a power washer and you see how white the sidewalk becomes after you power wash it off. That's because you just washed all the mold that was growing on that concrete. And you give it enough time and it'll break that concrete down.
Wow.
So it's tough to kill. But we have this wonderful innate and humoral immune system that is so strong. And we should never seek to destroy it. We should only seek to enhance and to work with it. And so when you're in a moldy environment, the number one way to treat it, the number one way, in my opinion, the only way to treat it is to get out first. Nothing else that I have ever seen in 25 years of practice works better than getting out.
Mhm.
Now, there's also what we call a poison dose response. So the more mold you have, the more toxins in your environment, the worse it's going to be. So some people, it's not. My case was pretty severe. My wife's case was pretty
Yeah.
severe. Some people have milder cases, but they're only mild at the current moment. Remember, as mold is eating your house and permeating into your air quality, that will progress if you don't figure out why. And the top reason mold grows, really the only reason mold grows inside of our homes, is water. If you
Mhm.
take away the humidity, and it doesn't have to be a busted pipe or a roof leak or an obvious source of water. It can just be ambient humidity above 55%. And the way that houses are built today, this is why we're seeing pervasive mold. This is why it's happening more. You, Anytime government intervention happens, we always see the consequence a few decades later. I'm not a big fan of government intervention for most things because it's bureaucrats don't understand. They're on their ivory tower. Anyway, we won't talk about that. But my my point is that we had all these like regulations coming down saying we need to be energy efficient. And so we built all these homes with greatest energy efficiency, all these new rules and laws saying you've got to have tight windows, tight doors. What did we do? We created a box of poisonous air for people to
Mm.
live in. According to the EPA's own documents, indoor air is 100 times more polluted than outdoor air. Um, Now take what we've done in the construction industry because people think usually there's a mentality that bigger is better, right? Like if I can get 8 ounces of soda for 69 cents, but I can get the big gulp, for 79 cents is better, right? Like that's the mentality I grew up with. Most of the kids in the 80s, that's me, a kid of the 80s, kid of the 70s, grew up with that kind of mentality. But it's the same thing in HVAC systems, right? So you build this house, it's tight, there's no air filtration or penetration. And you put this massive air conditioning unit on it because bigger is better, right? You want to cool your house fast. You want to heat your house fast. Bigger is better. More power, right? Tim the Tool Man. Remember that show,
Oh
right? More
yeah.
power.
Oh yeah.
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 Um, and what happens is you get an air conditioning that works so efficiently that it
Hmm.
doesn't have enough time to properly dehumidify the air in the home. Because
Hmm.
part of how dehumidification works is it's the length of time at which that air is running through that system. And so you get a house that maybe on the Gulf Coast where it's 80% humid outside, right? And that air conditioner, you're hot, it's humid, you're hot. You want, give me 68 degrees and I want it in 10 minutes. Okay, flip that thing on. Your house cools really quickly, really efficiently, but the moisture is not dealt with. And so you have this ambient moisture in
Yep.
your environment. And now that moisture leads to mold spore propagation because mold needs water to grow. And you should understand that all sheetrock, if you've got sheetrock in your house, when it comes, even if it's covered, when it comes from the factory, it has mold spores in it. Period. We know that. We've dissected. We know that sheetrock has mold in it. There's no way to not have mold in it. This isn't the sheetrock industry's fault. This is just a fact. So we know just by nature it's going to have mold in it, but when you add moisture to that equation, whatever mold is in that sheetrock is now going to have a fuel source to propagate. And so now your house becomes a living, breathing, mold base. So the number one way to control it is to control the humidity. And there's a lot of ways to do that. One of the things that I would recommend people do is first and foremost is set up a hygrometer in every room of your house. Very inexpensive to do a hygrometer. You can buy them, at the hardware store. You can buy them on Amazon
To
for
measure
like $6 or $10,
humidity, is
somewhere in
that for
there. Yeah, I
humidity?
have
Okay.
one on my refrigerator in my kitchen.
Yep.
It's a
Yep.
magnet. Just boom, right there. One in my bathroom, one in my
Yep.
bedroom, one in my living room. And I keep my tabs on it. And so I know what the basic humidity in my house is in the different rooms of my home. Some homes are more subject to humidity than others. Some rooms are more subject, I should say, like your bathroom if you take a hot shower, your kitchen when you're cooking, that kind of thing.
Hmm.
Your bedroom when you're sleeping, as you're breathing, that humidity from you is pushing up into your air. So you should have a general basis for understanding how humid each room in your house is. Not that you have to commit anything to hardcore memory, but like a range, right? Like in my house today, after the mold, I keep my house humidity at 47%. And the
Or
plus or
less.
minus,
Yeah. 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 Yeah.
right? But 47% gives I want it below 55% at all times because 55% is kind of once you go above that, now you start getting into
Hmm.
potential trouble zone. Um, so I have a full system dehumidifier that I've added to my HVAC system for that reason because I don't care if my HVAC cools or heats quickly or efficiently. I still want my house to be dehumidified properly. So we have a standalone dehumidifier that is set to 47%. So now if I have that set and I go through and I have all these hygrometers, I know if there's a problem right away. Like this past weekend, perfect example. We had a short power outage. It was like one of those blips, right? Anyway, the next morning, I'm looking at the hygrometer in my bathroom and it says 53%. I'm like, it's never 53% in here. It's usually 48, 49. Even after a shower, it's not 53. So what's happening? I knew instantly because I kind of keep a note of what it is.
Hmm.
Anyway, I went up into my attic and then lo and behold, my dehumidifying unit had shorted out with the power outage. It shorted.
Yeah.
It
Yeah.
killed it, right? So I turned it back on. Problem solved.
Hmm.
When you're talking about homes break. Things break down. Roof shingles come into disrepair. Silicone seals start leaking, right? Maintenance of homes can lead to water penetration and water
Hmm.
infiltration in the home. And this is why having hygrometers set up, it's really one of the best ways to give you early insight, right? If you are paying attention. Part of owning a home is maintenance. And
Hmm.
that's a part too in our throwaway society where people are like, I'll just buy a new one. I'll just buy a new thing. Your home's your responsibility, just like your children, if you're a parent, are your responsibility. And it requires work and it requires observation and it requires diligence. And you have to understand that construction companies make mistakes. And sometimes the mistakes are not on purpose. Sometimes they're just out of ignorance. That doesn't mean that doesn't mean that it's not their fault. It doesn't mean that they shouldn't be held liable for it. It just
Yeah.
happens though.
What are some of those? I was going to ask you the biggest lies or myths, but maybe the better question is what are some of those big mistakes that can happen with construction?
Man, I'll use my house as the example because in my home, they were all made. Yeah. And man, the conversation I had with my builder before we started the job was, I treat a lot of mold sick people. I really want to make
Yep,
sure,
yep, yep.
right? But I wasn't, I'm not a construction engineer. I'm not an architect. I was trusting them to do a good job,
Yeah, of
as you
course.
should be able to,
Yes,
right?
yes.
But here were the mistakes they made that are also very common mistakes. One of the mistakes was in the attic because we didn't seal our attic. So our attic in Texas, it wasn't a conditioned space. It was just open, right? Open, not open to the sky, but like, typical attic
Hmm.
with joists, beams. And your air conditioning in Texas, your air conditioning unit is typically, and all your ductwork is put in your attic. So like your attic in the summer gets 120 degrees, but inside those ducts blowing cold air, it's 70 degrees, right? And if the ducts aren't properly sealed, you can
Condensate.
get
Yeah.
attic air that's 120 degrees and 70-degree air conditioned air, and they meet, and then you get condensation.
Hmm.
And that's a source of water. So that's a very common mistake, is that
Yep.
your duct work is not properly sealed and it's in the attic where it's hot. That happened for us to an extent. But there's also in a non-conditioned attic space, there what are supposed to be by code, by building code, there's supposed to be something called a ridge vent, which are these vents running along the top of where the two where your A-frame of your roof, right, comes together. There's this ridge, and there's vents within that ridge, and then there are soffits on the outer aspect of your roof where there's holes on the outside where air can come into the attic, and if it's hot air, those ridge vents on top allow that heat to rise. And so there's just movement, air movement. This is what
Hmm.
keeps moisture under control as well as movement. That's a design. Well, in our home, they didn't have the ridge vents. There weren't enough of them. They shortchanged us. So there, when that warm air would come in from the
Mm.
exterior, that hot air didn't have enough exit space. So where did it go? It went down into my wall cavity because the other problem is there wasn't enough insulation. And so that warm air was pushing in behind the wall. Now, what's behind the wall? Sheetrock paper, right? And what did I say was in sheetrock? There's already mold in the sheetrock,
Mhm.
right? But now you just put all that
It's
hot
food for
moisture.
mold. Yeah,
Yeah.
yeah,
And
yeah.
so you can start growing mold that you can't see. And this is one of the common things, common construction defects that happens at homes today. Um, the other one is the oversizing of air conditioning units where
Yes,
they cool or
yes.
heat too quickly and the air is not being properly dehumidified. Another one is when you have what's called an ERV, which is a fresh air exchange air conditioning system, where what happens is, when you have a tight home, the air conditioner will pull air and it will just circulate air over and over and over again. But an ERV is where you pull fresh air from the outside in and you let stale air from the inside out. So it's an exchange,
Hmm.
an air exchange, so you get fresh air, and it's a good idea. But sometimes those things are improperly installed and they break. And so, like in one example I saw with a patient, their ERV system was supposed to be set at 5 minutes of fresh air coming in every hour, but theirs was set the opposite way. It was 55 minutes of fresh air every hour. And so their system couldn't handle the level of humidity because you're bringing in all that hot,
Yeah,
humid
yep,
air,
yep.
right? So it was just set wrong. Mistake. Um, So that's one. Another one is the foundation. So the foundation of homes, if you live, especially if you have, well, there's crawl space homes, but then there's concrete foundations. And where we live with heavy clay soil, we use concrete rebar foundations. And
Hmm.
what can happen is when they're laying, before they pour the concrete, they're supposed to put down what's called a vapor barrier, which is a thick layer of plastic. And a lot of times when they put that down, they cut corners. Like they don't put it down effectively, or they may not put it down in all the spots, or there may be holes in it because the construction workers are walking all over it with their boots and putting holes in it. And so now you get you get you get hydrostatic pressure coming from the soil pushing
Hmm.
up into your foundation. And if there's not a vapor barrier properly installed, you can get moisture coming up through your foundation. So if you've got like a wood floor on top of a
Hmm.
concrete foundation that doesn't have proper moisture barrier, that moisture can come up under that wood floor, and then that moisture can
Hmm.
feed mold growth under that wood.
Or even carpet. Yeah, yeah,
Yeah,
yeah,
or any, yeah,
yeah,
any of
yeah,
the
yeah.
above. Um, but because wood is mold food, right? So like wood is a cellulose material that mold can
Hmm.
eat, right? So it makes it a little bit easier even. In our home, we had an area as a step down closet that we had, but the humidity in that area, there was no proper vapor barrier, and the humidity was reading like I can't remember exactly. I think it was like 80%. That was our mold inspector found that because
Oh my
he
gosh.
used the humidity or
Yeah.
readout to find it. So that can be a mistake is that vapor barrier. Then you have a vapor barrier around the rest of your house. So like when they're putting up your construction, putting up your framing, usually the company that makes one of the famous ones that most people may have heard of is Tyvek. And it's like it's a product that basically it wraps around the framing and
Mhm.
prevents any kind of water intrusion coming in. So that barrier, sometimes they're supposed to take it all the way down to and fold it up underneath the framing. So as your framing is attached to your foundation, that vapor barrier should go to the foundation and be tucked up under. And a lot of times they just cut it off. Like in our case, they cut off like a foot and a half or something, so they didn't take it all the way down to the foundation. And it wasn't cut off in every area, but it was like we actually in our case we had forensic architects come out and do deconstructive testing of our home because we
Yeah,
wanted to know
yeah.
why.
Yeah, yeah.
Um, and that's what they found. They found that they didn't pull that Tyvek all the way down to the actual wrap it around the studs at the base of the home.
So is this what a building biologist would also help with? Like this giving you these tips. I mean, this is such good information, but you learned this the very hard way.
Yeah,
And
for
most people,
sure.
yeah, the expensive way. Most people don't know these things. So like when you're building a home, I'm just thinking, I know I've heard great things about Andy Pace. I've had him on the show, what is it, Green Home Design or something? To be a consultant as you build a home to make sure these mistakes are not made. I mean, what would your advice be to someone building a home? Like, what
Yeah, I
are the
mean,
resources or how how do we
if you're
prevent
gonna
this
if
from
you're gonna
happening?
build a home,
Yeah.
look at it's for many people, building a home is the number one investment that they'll ever make, right? It's the most money
Hmm.
they'll ever spend on a thing. Protect the hell out of that investment.
Heck yeah.
And you'll spend more, and maybe it means you have less house, and that's okay too.
Yeah, yeah.
But I would start at the architectural phase where you have to look at where you're building. And you have to look at the climate that you're building in because that matters too. There's all kinds of variable things like in Arizona where they use a lot of swamp coolers, there's a lot of mold because of those. Even though the climate is arid. I've seen some of the worst mold cases I've ever seen were in Arizona.
In dry climates. Yeah,
Yeah, in the dry climate. In the Houston area where I'm at, you have, other construction problems that, they let the wood sit out and they let the wood that's supposed to be a certain percentage of moisture, they let it expose to the elements. It's supposed to be covered at all times. And if it rains during construction, you're supposed to wait and let the lumber dry out before they dry in the framing. And they
yeah.
don't, right? They're trying to build a house in 3 months. And if you just happen to build yours on a rainy time of the year, you're going to end up with moisture in your walls, and that can be a problem. So not trying
That
to
could be
scare
mold
everybody,
jacks
but
number two is how to build a healthy home.
yeah. So hire an architect to look at where you're building your home, make sure there's proper drainage going away from the home. So like you
Hmm.
don't want to be in
Hmm.
a shallow rut where the
Right.
water comes into your house.
Right.
I would avoid building a basement if you could. Those are mold traps pretty much 100% of the time. Because you're building concrete under the ground, and so there's always going to be hydrostatic water pressure coming in. It's going to never end,
Hmm.
and that
Hmm.
just it's one of the things that if you don't need a basement, don't. I would recommend against them. But work with an architect who understands design build, and then once you've done that hire that architect to monitor the build, or hire an external engineering firm to monitor the build. So there are stages in the build, like when before they pour the foundation, they should be checked that it's properly. And don't trust city inspectors or county inspectors because these people they're just yes men for the most part. As long as the builder is building a relatively what looks relatively okay, they're just going to give them a stamp of approval. Very rarely will they stop them for the nuance of
Hmm.
construction. So you want an advocate on your team because your builder is going to try to do the cheapest job and the fastest job they can because that's the nature of the business.
Hmm.
That's the other thing is who you hire as a builder. You want to have maybe a pre-construction meeting where you're like, I don't care how fast you build it, I just want it built right, and I am going to hire an independent party, third party
Hmm.
build analysis person to come in and monitor your guys and make sure that they're doing things to our specifications and to this architectural specification because the architect can design the perfect home. But if the builders aren't building it to the architect specification, that's where the problem is. Our architect was fine. The builders are who cut corner. And they didn't do it. They didn't do certain things they didn't do to code. Our brick was improperly installed. Like they had what's called mortar damming. So that's when
Mhm.
they toss all the extra mortar behind the brick wall so that when it rains, brick is not waterproof. So when the water comes through the brick and rolls down the back of the brick wall, if the bottom weep holes are dammed up, then the water will permeate back into your house as opposed to floating away from your house. And all of our weep holes were dammed from mortar damming. And that's a construction defect that the
Mhm.
architect didn't say, hey, make sure you throw extra mortar behind the wall. It's just laziness. It was just construction laziness. So you need a person who understands all those things because I know a lot now, but I don't
Still
know.
more to learn. Yeah,
Oh, I'm
yeah.
sure. I'm sure there's still more to learn. That's the whole thing. We don't know what we don't know, and we
Mhm.
trust experts to help us. And so I'm just an advocate at this point of if you're building and you have the autonomous control over the build, you should have an advocate on your side who's third party from the builder, who's
Mhm.
holding the builder responsible and holding the
Yep.
subs responsible for the work that they do. I remember when my house was being built and I walked into the bathroom and they were putting in the bathroom tile and there was an arch that they were tiling and the tile guy looked at me and he said, "This is hard." And I immediately called my general contractor. I was like, "Get this guy the hell out of my house. If he thinks his job is hard, he's the wrong guy for the job. Like, what kind of professionals are you hiring here?"
Right.
I mean, yeah. Anyway, um, there's a really good book for those of you who just want to kind of dip your toes in this. It's written in layman's, and so it's not you don't have to be an architect to understand it, but it's called Mold Construction 2.0.
2.0. You told me about that when you interviewed me. I wrote that down. Yeah, yeah.
Yeah, author's name is Doug Hoffman, I believe. I believe that's right. It's either Hoffman or
You can
Kaufman.
find it if you just Google mold construction 2.0.
Yeah,
Yeah,
yeah.
yeah. That was a
But
very,
it's
yeah.
a download. It's a
Yeah,
PDF.
yeah,
And
yeah,
then
yeah.
the guy who wrote the book also founded Normie, which is an organization that trains people to do proper home inspections for mold. They're a good group. I know the guy personally. I've talked with him a few times, and I've always been impressed by the conversations that we've had. He seems to be extremely knowledgeable, but he's also very giving of his time. Um, and I appreciated that.
Well, you've been extremely giving of your time today. So I have to come back to mold jacked as we conclude today's interview. You talk about people being mold jacked. So can you just define that? You've probably already given us a handful of examples, but and then bring us to your documentary and your work this year. So let's come back to what mold jacked is.
Yeah, mold jacked is it's the act of having your life hijacked by an invisible force that you can't see, don't understand, can't put your finger to. And estimated 50% of houses in the US are water damaged. In Europe, it's closer to 40%, so it's not much better there. I see a lot of international patients who are in dampness. The problem is quite pervasive. I would say if you suspect you're being mold jacked, one, take our test. We have a quiz, a free quiz you can take at moldjack.com. Um, and if it matches up and lines up, then you need to get with a mold literate doctor.
Hmm.
Don't go to a non-mold literate doctor. I interviewed for the documentary more than 30 medically trained doctors and asked them the same question. How much training in medical school did you receive for mold related illness? And the answer was zero.
Yeah.
100% of the time, the answer was zero. Now, I went to, I think it was George Washington University. They claimed to have a mold training, and I went and tried to take it. And when I signed up for it, it's broken. It gave me a certificate saying I had taken the course. So I have a certificate from George Washington University that I've been trained in mold, and I don't display it because it would be a lie. But my point is that it's the only medical institution that has any kind of formal training that you can find online at this point. They don't get training. So just like you wouldn't go to an electrician to get plumbing advice, don't go to a medical doctor who has zero mold training to
Hmm.
get
Hmm.
mold advice. You got to
Right.
get with a mold literate doctor
Yep.
and get the right types of objective testing. Mold can be very subjective. And so what I mean by that is the symptoms overlap with a lot of diseases. Mold illness is a hydra because it can mimic autoimmune diseases of
Hmm.
every variety and every kind. And you want to get clarity around mold because you also don't want to create an invisible demon stress around mold if mold is not your problem,
Sure.
right? So this is where the objectivity and finding a literate doctor where they can do actual confirming tests that show that you are contaminated with mold mycotoxins or you have antibodies against molds and mycotoxins, and that you have viable evidence that that requires you to get some type of extensive mold examination to your home as well. So combining the mold examination of the human with the home, and that's the sweet spot where you're going to stay objective, because otherwise what happens is you get a crummy mold inspector who's not mold literate. And I know that sounds like an oxymoron, but in Texas, you need a weekend training course. I've taken the mold training course online for mold inspection, and it's a joke. So not all mold inspectors are equal. You want a very good literate mold inspector. Normie is that
Sure.
organization I was referring to. There's also the I think it's the ISEAI is an organization of environmental doctors that have a list of good inspectors. My favorite one, if you're in Texas and you're in my neck of the woods, Texas Mold Inspectors. Josh is the owner of that company. Shameless plug, but he saved my family's life by finding the mold.
Hmm.
That's who found my mold in 5 minutes. He had photographic evidence of the mold behind my walls, and literally in 5 minutes, after 4 inspections of people scratching their heads saying, "We don't know where it is." Um, so if you're in Texas, that's a great company to call. But if you suspect it, you've got to stay objective. Testing on yourself, testing on your home, marry the two together. If you find it in your home, it needs to be you either need to get out right away, immediately. When we found out, we left that day. We left. We walked out. 2 months I spent in a hotel. And I didn't care that the hotel may have had mold because it wasn't anywhere near as bad as the mold
Right,
in my
right,
house. Yep.
right.
Um, so you get out or you have it remediated properly. And to have it remediated properly, you need to be out. Don't ever have your home remediated while you're in it, because if they're opening up walls and they're opening up cavities, you're going to
Mhm.
get exposure that might make you even sicker than you already are. But you've got to stay objective, because in this process you're looking, and a lot of times you're looking for something that can't be seen with the naked eye, and that's what makes it in part so hard. If you're like, where's it at? I don't see it. It must not be there. Just because it's not there doesn't mean it doesn't exist. Radiation. Remember, Madame Curie died of radiation poisoning. That is the woman who discovered X-ray, because she couldn't see it. It didn't mean it wasn't hurting her. And you need to think of that same way with mold.
Mhm.
It just because you can't see it doesn't mean it's not there. And that's why it's so important that you get somebody who's forensic and relentless about ruling it in or ruling it out, so that you can move through your choices with certainty instead of question marks. Because nothing is harder than walking away from your house. Well, there's harder things than that, um, it's a hard thing to make. It's a hard decision to make.
Hmm.
And if you don't have the data that gives you the confidence that you're doing the right thing, you're going to second doubt yourself, and then you're going to find yourself going back in that house. I've had patients where they're like, well, yeah, I moved out, but I go back in. I had one guy in Arizona actually who would go back into his mold infested house because his workstation was there and he would do work for a few hours a day. I'm like, dude, move your workstation, you know? Anyway, stay objective, people,
Yep.
because if you don't, it can be a landmine of frustration, and especially when there's more than one person involved. If you are married, sometimes the spouse, male or female, doubts the other person, because sometimes not everybody in the house is sick, and so
Mhm.
you'll get. I remember even Josh, my mold inspector, who when I interviewed him for the documentary, he said, "I thought my wife was crazy." Like it was so hard on their marriage, right? Because he thought she was going crazy, until they found it. So you have to stay objective, because it can strain relationships. I've seen it cause divorces.
Yep. No doubt.
And Anyway, I don't know if I answered your question, but stay
You,
objective,
you told
test,
us,
don't
yes.
gas, find a doctor that knows what they're doing, find a mold inspector that knows what they're doing, so that you can either move on from the thought of this being your problem, or you can move toward this being your problem and address it head on and in an appropriate fashion.
Wow, wow, wow. Dr. Osborne, this has been incredible. Whether we're talking about grains, as we started the conversation, silently driving inflammation, or mold hiding in places we least expect. I think the through line is the same, that the things we assume are safe could be the very thing stealing our health. So I think a lot of listeners are going to walk away from this episode looking at their plate in their home a little differently today. So before I let you go again, let's come back to your documentary. When will that be out? Where can listeners find that and your other resources? I mean, and like you, what are all your social media platforms so they can follow you?
Yeah, if you want to follow me with mold, it's moldjack.com. We already the trailer's up there. You can watch the movie trailer. We're not hard dating it yet, but we hope December
Of
of 26.
26. Yep, yep. Awesome.
Um, if you want to learn more about gluten, get a ton of free resources, you can come visit me at glutenfreesociety.org. That's our foundation set up to help educate people about gluten. There's a free quiz there people can also take if you think you might be gluten sensitive and you just kind
Yeah.
of want to get a deeper answer. That might be a helpful tool for you.
Amazing. Okay. What is your top longevity tip?
The power to longevity is within the power of your choices. And if you are looking for a pill, if you're looking for an elixir or a potion or a medicine to improve your lifespan and quality of life, you're looking in the wrong direction. The power's in you. And what is the power? What is it? You have to choose. There's six what I call non-negotiable choices we make every day. The first is you have to eat real food. The second is you have to go to bed on time and get good sleep. The third, sunshine is not negotiable. You need sunshine every day, optimally 2 hours or more. Next, we need sleep. I'm sorry, I said sleep. Exercise. Um, Body is 70% water. Stagnant water stagnates, right? And festers. Movement is life. And if you're in a job where you're sedentary, you have to find the time to move. So movement becomes a priority. Number six, or number five rather, is clean air. Now that's, your lungs will clean your air, but part of that you don't control what others do. So filter your air. That's something you should invest in, a filter in your home. Number six is clean water. Like I said, you're 70% water. And if you're on a city water supply, now you're getting fluoride and chloramine and chlorine in Houston. 42 prescription medications have been identified in the drinking water after the city's done filtering it. So if you're not doing your own independent filtering, strongly consider getting that in place. But if you're focused on those six areas, then everything else just becomes nuanced. But the biggest needle movers are in those six areas, and that's where your biggest bulk of time and attention should go. And if you're taking care of that, you need less doctors. You'll be healthier. You'll be more energetic. You'll wake up with energy. You'll be stronger. You'll be fitter, and you'll live longer. And the life that you live will actually have quality instead of misery.
Mic drop. That was great. This was a very powerful, informative, amazing episode. So thank you so much for coming on the show today. This is great.
Well, thanks for having me. I really appreciate you letting me share my message with your audience.